If you have gum disease, you have to do this. Hi, my name's Connor, I'm a dentist, and in today's video we're going to be talking about gum disease. If you have gum disease, you already know that you have to go for regular routine cleanings, maybe every 6 months, but probably more frequent than that. It might be 4 months or every 3 months, just depending on what your gum health is like. However, the purpose of this video is that we're going to be talking about things that you should be doing in between those cleanings, things that you should be doing at home to help maintain your gums as best as possible. So, starting with number 1, an electric toothbrush. Electric toothbrushes are great and they're capable of making thousands of strokes every second, which a manual toothbrush just can't do. If you're using an electric toothbrush correctly, you should be getting an above average gum health. Moreover, if you're someone with gum issues, then getting that extra gum stimulation that you can get from an electric toothbrush can be much better for your gums than what a manual toothbrush can be. As a dentist, I would recommend an electric toothbrush to most of my patients over a manual toothbrush, and because there's just less room for error whenever you're using an electric toothbrush than there is with a manual toothbrush. Manual toothbrushes have a higher chance of being used incorrectly because they don't do the work for you like an electric toothbrush does. For any patient struggling with the health of their gums, whether it be gingivitis or more advanced gum disease, or someone who just gets a lot of plaque buildup, I do recommend getting an electric toothbrush to help with that. However, it's always really important, regardless of what toothbrush you use, whether it be an electric toothbrush or a manual toothbrush, using the correct technique is the most important part. And always remember to be gentle and angle the toothbrush towards the gum. A question that I get a lot is, what about people who have gum recession? Because we always tell people with gum recession to be very gentle whenever you're brushing your teeth. And yes, you should be gentle, but you don't want to be too gentle because you still want to be able to remove the plaque away from your teeth as well. And this is where an electric toothbrush does really well, again, because a lot of the more modern electric toothbrushes now come with a pressure sensor built in. So you will know if you're pressing too hard or if you're not pressing hard enough. The toothbrush will show you in some way, whether it be with a light or it might buzz, to say that you're pressing too hard or you're not pressing hard enough. It's really important to get that plaque removed from the teeth, particularly if you have gum recession, because plaque causes gum recession to get worse. Moving on to number 2, a water flosser. Water flossers can be great, but they don't necessarily replace traditional floss. If you have gingivitis, which would be swollen, red, inflamed gums that might bleed a little bit, or more advanced gum disease where you might have pockets or bone loss around the teeth, a water flosser can be a huge advantage. The reason for this is that if you have deep pockets, the water being fired into the pocket can reach down deeper into those pockets better than what traditional string floss can ever reach. However, as with the toothbrush, with the water flosser, it's really important to get a water flosser that has a pressure control. You don't want something that's going to be too hard, that's going to be stinging or hurting your gums. You want to be a little bit more gentle than that. Number 3 on this list is floss, and come on, we couldn't make a list or a video about gum disease without talking about flossing. I know it's annoying, but it's really beneficial for your teeth. If you're using something like a water flosser, you might think, well, why do I have to floss at the same time? While the water flosser is great, it doesn't reach everywhere in your teeth. It's great for getting along the gum line and in between the teeth, but there's one area where it doesn't reach, and that's the contact point, the contact between the two teeth. And floss is the best thing for getting and cleaning that area. So you could use a combination of your water flosser and some string floss, or a floss pick. That's a really good combination to use the water floss to clean most things, but then getting the string floss or the floss pick to get that last little bit in between the contact points. Number 4 is to try interproximal brushes or interdental brushes. There's a lot of different brands of these. Probably one of the biggest ones would be TP brushes. There's a lot of research done in dentistry about what is the best way to clean in between the teeth, and a lot of the research shows that these brushes are very effective at cleaning in between your teeth, and a lot of dentists would be starting to recommend these over traditional string floss. However, as with anything in your oral care routine, using it properly is the key to getting good results, and the most crucial part of this is getting the correct size of the brush to use in between your teeth. So I'd say get a few different brushes, or go to your dentist or go to your dental hygienist and ask them to tell you what sizes to use between your teeth. These brushes are particularly useful if you have larger gaps that would be in between your teeth, because the brushes come in a range of sizes and you can pick the one that suits best. Don't go for one too small because it won't touch both sides of the teeth, and don't go for one that's too big because it can start to create more of a space then than what you already have. If you also have normal size gaps between your teeth, you can still use TP brushes as well. They're really, really good. One of the other advantages of interdental brushes is that they're very easy to use compared to regular floss, because you're literally just putting the brush in and out from between the teeth. There's no, with floss, trying to wrap it around fingers, getting it down, getting a C shape, getting it all back. It's way easier than using floss. So generally people tend to miss less plaque whenever they're using interdental brushes than they would with floss. So with all of that considered, if you're using an electric toothbrush, using traditional floss, using water flosser, using interdental brushes, if you're using all or any of those, you're going to be giving yourself the best opportunity to improve your gum health and maintaining your gum disease at home. But that doesn't mean that you can't or shouldn't go to the dentist. It's really, really important that you still go and see your dentist and go and see your dental hygienist regularly to get those cleaning done, because there still will be tartar that would build up around the teeth. No matter how well or how good you clean your teeth, you're always going to get some tartar that builds up. And the only way to get that removed is professionally with a dentist or with a hygienist, using those special instruments to clean away that plaque and tartar. And that's what's really going to help you look after your teeth.